Generic name of this medicine is chloroquine phosphate. Lots of Bangladeshi companies are producing this medicine in different trade name. Available medicine are AVLOQUIN Tablet ACI Ltd, CLIT Tablet Hudson Pharmaceuticals Ltd, G-CHLOROQUINE Tablet Gonoshasthaya Pharmaceuticals Ltd, JASOCHLOR Tablet Jayson Pharmaceuticals Ltd, QUINOLEX Tablet Globe Pharmaceuticals Ltd, SEEMAQUINE Tablet Seema Pharmaceuticals Ltd, UNIQUIN Tablet Aexim Pharmaceuticals Ltd, ZENOQUINE Tablet Zenith Pharmaceuticals Ltd, QUINOLEX Syrup Globe Pharmaceuticals Ltd, ZENOQUINE Syrup Zenith Pharmaceuticals Ltd. Indications: Chloroquine phosphate is indicated in the following cases: treatment of malaria, prophylaxis and suppression of malaria, treatment of amoebic hepatitis and abscess, treatment of discoid and systemic lupus erythematosus, treatment of rheumatoid arthritis. Therapeutic class, anti-malarial drugs. Pharmacology. Chloroquine is used for malarial prophylaxis as a suppressive and in managing acute attacks of malaria. It is highly active against erythrocytic forms of P. vivax, P. malariae and P. falciparum. It influences Hb digestion by increasing intravesicular pH in malaria parasite cells and interferes with the nucleoprotein synthesis of the patient. It is also effective in extra-intestinal amoebiasis. In raw chloroquine and more effectively hydroxychloroquine have a disease-modifying effect. Treatment of malaria. Partially immune adults. A single dose of 4 tablets. In severe attacks, the dosage schedule for non-immune adults should be adopted. Partially immune children. Under 1 year, 1 to 2 single dose in 5 ml spoonful. 1 to 3 years, 3 to 4 single dose in 5 ml spoonful. 3 to 6 years, 4 to 6 single dose in 5 ml spoonful. 6 to 9 years, 6 to 9 single dose in 5 ml spoonful. In severe attacks, the dosage schedule for non-immune children should be adopted. Non-immune adults. P. falciparum infections, 4 tablets initially, 2 tablets after 6 to 8 hours and then 2 tablets per day for 2 days. P. vivax group infections, a single dose of 4 tablets followed by a course of treatment with primaquine phosphate 15 mg base daily for 14 days. Non-immune children. Under 1 year. 1 to 2 initial dose in 5 ml spoonful. 1 dose to be taken 6 hours later and then daily for 2 days in 5 ml spoonful. 1 to 3 years. 3 to 4 initial dose in 5 ml spoonful. 1 to 2 dose to be taken 6 hours later and then daily for 2 days in 5 ml spoonful. 3 to 6 years. 4 to 6 initial dose in 5 ml spoonful. 2 to 3 dose to be taken 6 hours later and then daily for 2 days in 5 ml spoonful. 6 to 9 years. 6 to 9 initial dose in 5 ml spoonful. 3 to 5 dose to be taken 6 hours later and then daily for 2 days in 5 ml spoonful. Prophylaxis and suppression of malaria. Adults, 2 tablets taken once a week, on the same day each week, during exposure to risk and continued for 6 weeks after leaving the malarious area. Children, syrup, the following doses should be taken once a week, on the same day each week, during exposure to risk and continued for 6 weeks after leaving the malarious area. Under 1 year, 1 single dose, in 5 ml spoonful. 1 to 3 years, 2 single dose, in 5 ml spoonful. 3 to 6 years, 2 to 3 single dose, in 5 ml spoonful. 6 to 9 years, 3 to 5 single dose, in 5 ml spoonful. Children tablets, for practical purpose, children over 12 years may be treated as adults, and for those below this age, the following proportions may be applied. Under 1 year. Adult dose 1/4 tablet, 1 to 4 years, 1/4 adult dose, 1/2 tablet, 4 to 8 years, 1/2 adult dose, 1 tablet, 8 to 12 years, 3/4 adult dose, 1.5 tablet. Concomitant therapy with phenylbutazone predisposes to dermatitis, antagonizes effect of neostigmine and pyridostigmine, reduces bioavailability of ampicillin. Cimetidine inhibits metabolism of chloroquine, raising plasma levels. Contraindications: there is no absolute contraindication to the use of chloroquine. Interaction. Concomitant therapy with phenylbutazone predisposes to dermatitis, antagonizes effect of neostigmine and pyridostigmine, reduces bioavailability of ampicillin. Cimetidine inhibits metabolism of chloroquine, raising plasma levels. Contraindications. There is no absolute contraindication to the use of chloroquine. Side effects. Chloroquine is well tolerated at the standard dosage regimens. Side effects such as headache and gastrointestinal disturbances which may occur are not of a serious nature. Where prolonged high dose is required, side effects can be of greater severity and patients may develop skin eruptions, occasional depigmentation or loss of hair, difficulty in accommodation, blurring of vision. Corneal opacities disappear completely when the drug is stopped. Rarely thrombocytopenia, agranulocytosis and aplastic anemia have been reported. The most serious toxic hazard of prolonged therapy with doses is the occasional development of irreversible retinal damage. For this reason, considerable caution is needed in the use of chloroquine for long-term high-dosage therapy, and such use should only be considered when no other drug is available. Defects in visual accommodation may occur on first taking Chhloroquine, and patients should be warned regarding driving or operating machinery. Pregnancy and lactation. As with all other drugs, the use of chloroquine during pregnancy should be avoided if possible, unless in the case of threatening infections, in the judgment of the physician, when the potential benefit outweighs the risk. Precautions. Caution is necessary when giving chloroquine to patients with porphyria who also have hepatic dysfunction or cirrhosis, as the drug may precipitate severe constitutional symptoms and an increase in the amount of porphyrins excreted in the urine. This reaction is especially apparent in alcoholics. Patients receiving chloroquine continuously at higher dose levels for a period longer than 12 months or at weekly intervals for a period of more than 3 years as prophylactic against malaria, or the consumption exceeds 1.6 grams per kilogram, should undergo ophthalmic examination at 3 months interval. Use in special population. Amoebic hepatitis, 4 tablets daily for 2 days followed by 1 tablet twice daily for 2 or 3 weeks. Lupus erythematosus, 1 tablet twice daily for 1 to 2 weeks followed by a maintenance dose of 1 tablet daily. Storage conditions. Store at room temperature in a dry place, away from light.